Welcome. My name is Ernest Huhta. I'm the owner and director of Naturale Alternatives here in Monaga, Minnesota. And we have clinic sites distributed throughout the entire region. We affect the Fargo-Moorhead area. We also have clinic sites in Alexandria and also down in the Twin Cities in Excelsior, Minnesota. Dr. Mark Wheaton and myself clinic together. He's a sports medicine physician and a prolotherapist. And we've worked together for 20 plus years. Here in Monaga, we also have Dr. Dave Anders, who's a chiropractor, Dr. Dave Gottenberger, who is also a chiropractor. And what Naturale Alternatives really truly is, and we talk about it in depth in the entire concept and the vision of this clinic, and that is the synergy of multiple practitioners working together, all of us focused on one thing, and that is your healing and your rejuvenation. Today, we're going to address an issue that we see in our clinic literally every single day. There is not a day that doesn't go by that we don't have people coming in and complaining of headaches and migraines. And headaches and migraines are not the same thing. And in fact, it's very interesting, as this morning as I was doing some research for the presentation, Mayo's got an incredible amount of research on migraines and headaches that people can go to their websites. You can go all over and find information about migraines and headaches. But the one thing that is missing from so many of these is a functional part of my training and background, and especially associated with a mentor of mine by the name of Dr. Bill Faber. And Dr. Bill Faber owned the Milwaukee Pain Clinic in Milwaukee, Wisconsin, and he talked about the fact that structure determines function. So in other words, if you have poor structure, you're going to have poor function. If you've got good structure, you're going to have good function. And so what does that mean in real terms? Well, if I take away your ligaments and I take away your muscles, your bones will fall to a heap on the floor. They're the only two things that are holding us together is ligaments and muscles. Muscles give us movement, and ligaments hold bone connected to bone. So every single joint in the human body, wrist, elbow, shoulders, hips, are held together by ligament structure, which is the underlying support component of our bodies. Muscles create stabilization and movement also, but the primary function of muscles to move our bodies. There's 600 plus different muscles throughout the entire body, and ligaments underneath all of that to support. So our goal here today is to show and help you understand. Go on and do the research and find out, but we are going to approach the idea of addressing migraines and headaches through affecting structure, because ultimately that's where it comes from. And that structural issue could be everything from whiplashes, car accidents that have happened, women who suffer with dysmenorrhea or hormonal issues, pelvic dysfunction. You cannot believe the number and the issues that we face in our clinic that are all structurally related and creating these symptoms. And one of the things that we see that is a very, very powerful component of structural dysfunction involving ligaments is a syndrome that is called Bairreliou syndrome. You can also research that on the web, and it's spelled Barre-Leiou syndrome. And that syndrome talks about ligament instability in the cervical structure that can cause headaches and migraines. So again, our goal is to help you understand. I'm going to functionally show a little bit of time with a patient here to help you realize just one little breadth of how we might affect treating people for migraines and headaches. So a practical application of treating people with migraines and headaches in our clinic consists of integrating our therapy in the entire spinal structure. So I'm going to be using an electroacuoscope. This is a tool that we specialize in our clinic that is a microcurrent therapy device. And microcurrent therapy is very, very powerful in that it's very passive, easy to receive. It doesn't produce lots of contraction in muscle structure. Like if you go to perhaps a physical therapist or chiropractor, a lot of times they'll put a set of pads on you and you can actually feel the contraction or isotonic contraction of the tissue because of the device that they're using. We don't have any of that here. And so the electroacuoscope powerfully treats the entire spinal structure from top to bottom. You can see I've got a set of pads placed down here on her lower back, and I'm going to start beginning by going in and actually using a Y probe to treat her neck and release all the muscle structure in the upper thoracic and her cervical spine. Well, why is that important? If you remember earlier, I indicated that one of the root issues that we see in headache and migraine complex is that the low back is as big a part of the pain and dysfunction that a person is suffering with, sometimes even more so than the neck. And a lot of practices focus their time and energy on the cervical spine as being the root source of migraines, or TMJ area, when in fact we find that the low back is as big a part of that. So I'm going to integrate the entire area of the spine together to get this effect of treating the entire spinal cord. And why is this important? Well, every human has what is called cerebrospinal fluid, which comes all the way from the brain structure clear down to the sacral stem. So it's moving back and forth, top to bottom, constantly flowing and moving on an entire spinal quarter. So if something is fixated or damaged or irritated here, it's going to affect the flow of cerebral spinal fluid top to bottom. And many people battle with injury issues that have happened to their low back that are ultimately contributing to their migraine or headache complex. So our goal, again, is going in right now, as I'm doing with microcurrent therapy, the electricity is tied to her low back. If we go over here and look at the machine, I've got the positive pole of this set of leads tied up to her low back, and I'm doing the negative set of this pole to the probe that I'm actually working in her neck, which is forcing the current to go from top to bottom. And the key here is to understand electricity always finds the path of least resistance. And by setting up the negative pole and the positive pole of electricity at different ends, I'm forcing that current to literally follow wherever I'm moving with this probe. As I'm moving, the current is moving with it. And so it really creates a profound way to treat and affect structure. Now, in another session, I'll get into talking about how we address the mid-thoracic spine and the low back with an actual application of the same nature. But again, today's lesson is addressing the issue of migraine and headache complex. Thank you again for spending time to learn about how we might address headaches and migraines. And obviously, every person's issue is different. Please come into our clinic, get an opportunity to experience and understand the natural alternative way of addressing these very common disorders that people suffer with. You can find us on the web at naturalealternatives.com. And don't forget, that's natural with the E at the end of it. So naturalealternatives.com, or you can call our clinic at 218-564-4200 here in Monaga. And welcome. We'd love to have an opportunity to help you with your pain and get you back on a road of healing. Thank you.
Thank you for watching Wellness for Life.